So we've seen a lot of patients here with type 2 diabetes, and
Right.
you've kind of counseled them on how to change their lifestyle and diet, and it's estimated that over 50,000 Belizeans have type 2 diabetes right now.
Approximately.
So why do you think diabetes is such a big problem right now?
What happens normally, diabetes is a disease that is hereditary. Okay, right? A lot of times these Belizeans, the population are not very well educated on this type of disease. A lot of these guys they come with a mentality that they don't care, right? And whenever they come to the hospital, in the worst situations, in extremely poor conditions, right? What happens is that these guys they don't take good advices. If we give them, they don't take advices and they continue doing what they want to do. Okay, they're used to a lifestyle. Okay, and whenever they're used to a lifestyle, they won't change. They won't change. We can tell them, don't eat this, don't eat that, not much of sugars, not much of soft drinks. Okay, eat your natural fruits or natural veggies, but they won't take into consideration none of these. Not only that, whenever we treat these patients, these guys they take their pills and they might just leave it on the side and not take it. Right? Whenever they come with extremely high glycemias, and whenever we do blood works on them, we realize that if the kidneys are affected, some other organ or some other pathology has arisen, due to the fact that his patient is decompensated and has been decompensated for a long period of time.
Right.
Right.
So do you think it's more of an unwillingness to change their ways, or more of an inability? Like they don't have the means here?
It all depends as well, because the hospital here provides them with metformin, glibenclamide. It provides them with all types of insulins. But these guys, sometimes they come to the clinics for a follow-up, sometimes they don't. It's all, how do you call it? It's them not reaching out to get their follow-up.
Okay.
Okay.
So some of the complications of diabetes are vision loss, nerve damage, impaired circulation, which can lead to amputations, and it's a contributing factor for cancer and kidney disease. So what do you think it'll take to get people to connect all of these major complications to their diet?
I would suggest we would have to do some serious campaigns. Campaigns to reach out to them. Because a lot of these guys as well, not to be to only looking at the bad. Also, these guys they work. They work a lot. Especially the guys, the cane farmers. People that they work 8 hours, 10 hours, 12 hours. They don't have time. Okay, they work from Monday to Friday, or sometimes from Monday to Sunday. Okay, and it's true that these guys don't have the time. Okay, maybe we could reach to them, educate them more if it's possible. Maybe take the medications, like how the outreach is doing. I really like ISL and the project that they do, due to the fact that they help us a lot in reaching to the patients that are in the villages, in the remote areas, which is excellent, very excellent idea. And I congratulate really a lot the staff of ISL, because they're doing very much.
Do you think it's enough and that it's effective?
It's very effective.
Do you think there's anything else that...
If it would be more often, it would be better.
More often.
Okay, but I understand that this can't be done so frequently, and I like the fact that you guys come over too. You guys come over and you guys learn and see and have a hands-on on our patients, Belizean people, and you learn a lot. Okay, that's very good. Okay, so it goes both ways. It helps us and it helps you guys.
Okay.
Right?
Do you think we're doing enough to help the people right now?
Well, yes, of course, very much.
Like you were saying, a lot of people don't listen and they're stubborn and they're stuck in their ways. So
but whenever we speak to them, we instill, these things, maybe they might learn.
Do you think it might stick?
It might stick.
Eventually. Do you think there's any changes to the people that work 10, 12 hours a day? Do you think there's changes they can make to their diet or lifestyle?
Course,
is it feasible for them?
Because remember, we had a gentleman that came in with high sugar and high sugar levels or high blood levels, and he works the whole week. Right, he's a cane farmer,
Mm-hmm.
and he took out a time to come here and get some medication from us. Okay, get a consult with us and for us to treat him appropriately. Right, so it's very good. It's very good that you guys are reaching out, you know, to these people, right?
Right. So, are there any current preventative measures right now for diabetes?
It's well, what in our society we a lot of how could I say a lot of Belizeans, they love Coke. Okay, they love soft drinks, they love fast foods, they love fried chicken. You know, these are all risk factors for
Mm-hmm.
high blood pressure,
So the cheap and readily available
hyperglycemia.
foods right
You
now.
know, even if I'm not born with sugar, I mean with a diagnosis that I'm diabetic, I can still acquire diabetes, right? Due to these bad the ingestion of these bad um, foods that I mentioned earlier. So going back to the question, what was it? The question?
The current prevention
Yeah.
efforts.
We have to speak to them and inform them that they need to not consume these types of food. To eat healthier.
Right.
All right. Eat their fruits, their vegetables. Drink abundant water. Okay. Natural juices are great.
Okay.
I
mean, I've seen a million ads for Coke around here,
Yeah.
everywhere you go, but I haven't seen a single flyer.
The
talking
norm
about the
here
dangers
is
of
that
diabetes.
whenever I see you in the streets or whenever I see you at a parlor, what do you want to drink? You want a Coke? You want a beer?
Mhm.
Right? Because that's your good friend, or maybe that's a person that you know. You want to treat him good, and that's the first thing. They'll say, "Oh yeah, hey, do you want a water?" No, you will never get that.
So how do we get people to understand, like, that's not treating your friend good, that's putting them at risk for all
We
of
have
these
to speak to
complications?
them. Whenever we do these consults, we have to explain to them Coke is not good,
Right.
fast foods aren't good. Stick to your foods. Your
What do you think the
vegetables.
best way is to get it to stick in their heads?
Mm.
When you give people nutrition
Well,
advice when they come in for diabetes, they kind of laugh a lot, and they're
What
like,
I do,
"Ha, ha,
yes,
ha,
they laugh.
I
They
love
should.
sugar, I love to
Yes,
eat."
they laugh. But whenever I tell them the complications, I normally go direct to the complications and the end result. Okay, I always go to that.
Hmm.
Okay, and I tend to scare them a bit.
Okay.
Right?
Do you think that's necessary?
It's very important.
Do you think there should be more of that?
There should be more of that, more education on the disease.
Okay.
Okay, so
Sounds good. Thank you.
you're welcome.